Imagine you've just walked into a bakery. The smell of food entices you as you order a piece of chocolate cake. You take your first bite and your senses are immediately overwhelmed with pleasure. You may be asking yourself, why do we feel this way? Another thought may come to your mind as you remember your mother scolding you from eating a second piece of dessert. When does this experience go too far? In this presentation, I'll be focusing on two main questions. What is pleasure in reference to psychological theory and its consequences? So, you may be wondering, what is pleasure? Pleasure is an experience triggered by activities such as sex that stimulate the reward pathway found in the ventral tegmental area to the nucleus accumbens. Here, the neurotransmitter dopamine is transported along this pathway. It can also be defined as an experience that is associated with feelings of happiness, euphoria, and thrill. While not an emotion in itself, it is present in several emotions experienced by humans. Several theories that explain the role of pleasure, one of the most prominent being Freud's pleasure principle, as it states that pleasure is a central factor in driving humans to fulfill our instinctual needs, especially the id personating aspect, which seeks immediate gratification. An example of this can be seen in young infants, as they are often regarded as egocentric. Research suggests that the reason for this is for the survival of the infant as it seeks out its immediate needs. In addition to this, the concept of operant conditioning developed by B.F. Skinner is also applied to pleasure, as a stimulus can be conditioned to elect or repress a pleasurable response through reinforcement or punishment. An example of this can be seen with money and gambling, as a study conducted by Maria Montes and Weatherly illustrated that positive reinforcement of money can stimulate pleasurable responses to gambling. However, despite pleasure's useful evolutionary function in social bonding survival, pleasure has shown to have adverse consequences, addiction being the most prevalent within contemporary society. Addiction occurs when a person becomes reliant and preoccupied on a substance to receive pleasure, despite the harmful consequences that may follow with its pursuit. Freud's pleasure principle applies to addiction, in which an individual is driven by the misinterpretation of the substance as a physiological need. Research has shown that addiction has led to reduced responsiveness to natural rewards, dazed states of consciousness, depression, anxiety, and even impaired neurological functioning in individuals who pursue addiction in the long term. Research has outlined methods to cope with addiction, including complete withdrawal from the drug. However, this process has been shown to be difficult due to the body's reliance of the drug as a need rather than a want. So, what is the take-home message? Well, overall, pleasure is a concept that can be considered both an experience and a dimension of emotion. Additionally, pleasure has been shown to be essential in animal survival and social bonding. However, despite this, pleasure has shown to have adverse consequences, as overindulgence has shown to be linked with addiction as well as a deterioration in brain functioning. If you would like to learn more, head to the link in my bio to my book chapter. Thanks for watching!